washed my hands and I've washed my stethoscope. Hi, I'm Ryan Haney. I'm a nursing student for my BSN at Winston-Salem State University. I'm recording this video with Joelle Cosentino, a fellow coworker at Duke Hospital in the OR. She has given me consent to video her and upload this to YouTube for a grade by my professor.
I gave consent.
Alright, so the first thing I'm going to do is get your vital signs. Once we get vital signs, we're going to go through a health history. And then after the health history, we'll start your physical assessment of your heart and your neck vessels. Okay? Alright, so the first thing I'm going to do is listen to your heart and get a pulse, okay? Alright, your pulse is 68, your respirations were 14. The next thing I'm going to do is get your blood pressure, okay? As I'm doing this, could I get your height and your weight, please?
I am 5'3" and 140 pounds.
Alright, thank you for that. Okay, your blood pressure was 124 over 68.
Okay.
Alright. I'm going to ask you to do is get a temperature. So I'm going to have you put this under your tongue and hold it until it beeps. And your temperature is 98.3. Okay, so the next thing I'm going to do is ask you a few questions about your health history, okay?
Okay.
Have you had any recent chest pain?
No.
Okay. Have you had any cough recently?
I don't think so. Maybe sometimes a little bit at the end of the day, but I think maybe since I work out every day and I'm just, it's just like a dry cough. Nothing comes up or anything, but it's just like maybe more allergy related.
Okay. Okay. Do you have any shortness of breath? You mentioned being at the gym. Whenever you're working out, do you find any shortness of breath?
I mean, if I'm really going hard, but that's expected. But nothing out of the ordinary. Nothing when I go upstairs or normal activity is fine. Yeah.
Okay. Sounds good. You mentioned that you exercise. How often are you exercising?
I usually go to the gym about 4 to 5 times a week, and I'm usually there for about 2 hours.
Okay. Good. Good for you. What does your diet look like?
Well, I do a lot of meal prepping, so it's pretty scheduled. A lot of veggies, a lot of lean proteins, some really good healthy carbs, sweet potato, rice, things like that. And I'll occasionally splurge on the desserts, of course, but nothing excessive. I usually try to eat pretty clean for the most part.
Okay. Let's go go back to the cough and your sleep habits. When you sleep at night, how many pillows do you sleep with?
I usually have about one good fluffy pillow that has some contour to it, so it helps. I sleep on my side, and then I also sleep on my stomach a little bit too.
Okay, good. So I'm going to ask you a little bit about your work life. Um, do you have any swelling while you're at work? Any swelling of your extremities?
My legs, when I'm done with work, and I'll take my socks off. I don't wear compression stockings, but I'll wear just like regular dress socks. And where they end at the base of my calves has a little indentation sometimes. If I'm on my feet a lot or the whole shift, then it can tend to get a little bit. They get swollen more for those days, but it's not every day, and it usually goes away within about a half hour or so.
Okay, so when you take your socks off and
put my legs up and
okay.
relax, and then it's fine.
Okay. When you notice it, do you notice that the indentation stays once you've gotten your socks off, or does that kind of dissipate?
It dissipates
quickly.
Yeah, it dissipates
Okay.
like within about a half an hour or so.
Okay. Have you ever noticed that whenever you palpate the swelling, your fingerprints stay?
No.
Okay. So now I really want to ask you about your family history and your history related specifically to heart health.
Okay.
Do you have any history of hypertension?
No.
Or increased cholesterol? Any cardiovascular disease? Ever had a heart attack? Or stent or catheter placed in your heart to remove occlusions?
Nope.
Okay. Do you have a family history? Anyone in your family ever had hypertension?
My dad's side, a lot of my uncles and my dad had high cholesterol.
Okay.
But they can take a pill for it, and it usually is pretty managed.
Control.
Yeah.
Okay. Has anyone in your family had a history of heart attack?
No.
Okay. Do you smoke?
I don't smoke. No.
Do you drink?
Socially, probably about maybe one or two a week or so.
Okay. And do you take any illegal substances?
No.
Okay. And as far as medications, is there anything you're taking right now that may affect your heart?
I do take Adderall for ADD.
Okay. Any other supplements that you take that may increase your heart rate?
Other than caffeine, like in coffee, and then I usually take a pre-workout before the gym, but that's about 3 o'clock is when I usually take that. So nothing like right before bed.
Good. So the next thing we're going to do is check your neck vessels. The first thing I'm going to check is your carotids, okay? So I'm going to palpate her carotids one at a time, not both pressure occluded, because if I do so, I can occlude blood flow to the brain and cause a vagal response, reducing the heart rate. So I'm going to palpate medial to the sternomastoid, and I should feel a moderate pulse or a 2+, and it should be brisk on the upstroke, slow on the down. I'm going to do the same thing on the other side. Good. The next thing I'm going to do is I'm going to listen or auscultate with the bell of my stethoscope. Doing so gives us the ability to hear a lower pitched tone. So I'm going to listen in 3 areas. The first, I'm going to listen at the angle of the jaw, and then I'm going to listen mid-cervical, and then at the base of the neck. Okay? What I'm listening for is a bruit. Bruit is a swishing sound caused by an occlusion of the vessel by half to 2/3. No bruit does not mean that you do not have an occlusion. If you do have an occlusion and I don't hear sound, it means that your vessel is fully occluded. Okay? So I'm going to start listening now.
How do you want me to breathe?
I would like you to take a deep breath in and exhale. And as you exhale, hold. Okay?
Okay.
That way I can hear a little better.
Okay.
Again. And one more time. And you do the other side. Same thing, okay? Good. No bruise were heard. Okay, so the next thing I'm going to have Joelle do is lay flat or supine, as you can see. And we're going to be looking for her external jugulars. So I'm going to have her look slightly to her right. And then I'm going to take this flashlight and shine over the vessels here on her neck. And what we're looking for is a pulsation to see if she's got a strong pulse. And I can see that here. I can see her pulse. And then what we're going to do is do the same thing on the other side. We're going to have her look slightly to her left. I'm going to shine a light over. And again, I can see a good pulsation. Okay. And then we're going to have Miss Joelle sit up at about a 45-degree angle, 30 to 45 degrees. I'm going to have her do the same thing. And I'm going to have you look to your left first. And what we're looking for is to make sure that it's flat, but I can still see a pulsation in her skin. But we do not have any distension of the jugular. I'm going to come back around to your other side and have you look to your right. And do this one more time. Alright, and I can still see pulsation, but do not see any distension. The jugular here is flat and not extended. We're also going to look here at, you can sit up just a little bit more. You look uncomfortable.
Sorry.
So we're going to look for your internal jugular. We're going to do the same thing, but we're going to be looking more at your suprasternal notch. We're looking here, okay? So, one more time. We're going to palpate. You can feel. We're making sure not to feel our carotids. We're going to palpate on this side. Good. All right, the next area of Joelle that I'm going to be inspecting is her precordium. Precordium is the area directly over the heart of the chest. So what we're looking for right now is whether there's any visible pulsations and not just respiration movement. So we do not see any pulses here in her chest. So next we're going to palpate her apical pulse at the left midclavicular, fifth intercostal space. So we'll count 1, 2, 3, 4, and 5 midclavicular. And I'm going to ask that you lift your breast out of the way, please, as I palpate. I'm going to palpate here. Good. And then we're going to start listening with our stethoscope. Okay, so I'm going to start with the diaphragm so I can hear the high-pitched tones. And then we'll listen again in the same areas with the bell for the low-pitched tones. So I'm going to start at your aortic area, which is going to be on the right second intercostal sternal border. So we're going to do 1, 2. We're going to listen right there. And if I can have you exhale and hold your breath for me. Great. I hear S1, S2. I hear no murmurs for clicks, for extra sounds. The next spot that we're going to listen to is the pulmonic area. That is at the left space, sternal border. Good. Again, I hear S1, S2. I hear no clicks, no murmurs, or extra heart sounds. The next spot we're going to listen is the tricuspid area. It's at the left fourth intercostal space, still at the sternal border. So we've counted 1, 2, 3, and 4. If I can have you hold your breath for me on exhalation. Good. And the last spot that we're going to listen is the mitral area. The mitral area is located in the left fifth intercostal space, midclavicular. Good. And I still hear S1, S2. No clicks, no murmurs, or extra heart sounds. And we're going to do this again with the bell of our stethoscope just to hear some lower pitched tones, and it'll make it easier for us to hear any extra heart sounds. And the last place we're checking is again the mitral. Good. Still only hear S1, S2, no extra heart sounds, no murmurs, no clicks. And that concludes